Welcome to Doodles MD. I'm Falake Lawal, your public health, infectious diseases, and internal medicine physician. Today has been designated as World Malaria Day, so I'm lending my voice to this important disease. Malaria is a mosquito-transmitted infection that is found in more than 100 countries and territories, mostly in tropical regions around the world. There are 5 species of the parasites named Plasmodium. There are 5 different types of Plasmodium that affect humans, and each one is a little different in how it presents when it causes an infection. The parasite is transmitted by female Anopheles mosquitoes when they bite human beings for a blood meal. So the presence of malaria in an area actually requires a combination of 3 things, which is a high human population density, high population density of Anopheles mosquito in that same area, and high rates of transmission from human to mosquito, which is contact with Anopheles mosquitoes and from mosquito to humans. So a significant reduction in one of these 3 factors actually impacts the level of malaria infection in an area or in a region. What is the impact of malaria globally? According to WHO's latest World Malaria Report, there was an estimated 241 million cases of malaria around the world and about 627,000 deaths. This was in 2020. And this is an increase from the 2019 figures. Unfortunately, about 67% of the deaths attributed to malaria are in children under 5 years. Also, malaria as a burden slows economic growth in countries, and in African countries, it's been found to slow the economy about 1.3% every year due to citizens losing 1 to 5 days of work and wages. Household malaria-related expenses is also high, between 7% up to 30% in very poor households. Studies have also estimated that many African countries lose up to 1,000 upwards of 3,500 years combined per 100,000 people of either life lived or quality life lived. So basically, people either die early, a combination of early deaths, or loss of ability to live a full life, all of that combined in 100,000 people. And so we can see that the impact of this disease, even though it's common, it's been around for so long, it's perpetuating, and it's actually burdensome for the countries that are affected. Going forward, things don't look too well, especially because of climate change, unfortunately. Higher temperatures, longer warm seasons, more rainfall, flooding, displacements are factors that have been contributing to an increased mosquito population. And this is because mosquitoes mature and reproduce faster in warm temperatures. The longer warm periods allows for them to be in season longer and be able to transmit infection more. Also, depending on the flooding, there's more breeding areas for malaria. Also, countries that have previously not been affected because they are having more warm temperatures are more susceptible for advancement or encroachment of mosquitoes in their area. Now, what can we do? In terms of prevention, as a general populace, we can work, and work has continuously been done on reducing mosquito population by removing areas of shallow, stagnant waters, indoor residual spraying, larvicide or adulticide, which is basically just spraying areas with pesticides and chemicals, or sometimes just layering oil on slow waters or small bodies of waters to prevent the larva from growing. Prevention of bites by mosquito is another thing. So using mosquito nets, insecticide treated nets, insect repellent creams also work. For travelers especially, prophylactic medication is important. So please talk to your doctor if you're traveling to a malaria endemic region. More newer things includes a vaccine that is now in the works and has been tested in several regions. There are also biocontrol measures that are innovative and working on reducing the mosquito population, which is very important in stemming these diseases. So it's not all doom and gloom, because about 32 of the affected, countries or susceptible countries are listed by WHO to have eliminated malaria in their region, including some Caribbean countries. And this is because they've had no domestic transmission within the past 3 years. So eliminating malaria is possible. It's just a matter of, as citizens, as communities and countries, governments, are we taking it serious enough? One word of caution I would just like to put out there is that studies have shown that there are high rates of co-infection of malaria with other parasites or viruses. So if you feel like you've been bitten by a mosquito and it doesn't quite feel like malaria, or you've treated malaria and it's not going, you want to go back to your doctor to get evaluated for other possible diagnoses, because it might not be malaria. It could be a viral infection or another parasite that really could be treated. So thank you for listening. I'm Folake Lawal on Doodles MD. Click the like button, subscribe to our channel for more content, follow us on social media, and talk to you next time. Bye.